Hey, so you had some questions about newborn vaccinations from about newborn and birth to about 2 months. Okay. So the CDC does recommend a little bit of vaccine. So at birth, they would recommend the RSV, and this is just a respiratory syncytial virus immunization, and it's just one dose of that, and it's just at birth. The next one is hepatitis B, and that does have two doses, so two separate injections, and that is at birth and again at 1 month. The next one is the rotavirus, that's at 2 months, one dose. DTaP, that stands for diphtheria, tinnitus, and pertussis. Vaccine, one dose, 2 months. Next is the pneumococcal conjugate injection. That's one dose at 2 months. And the next one is the polio vaccination, one dose at 2 months. The state of Texas follows the CDC recommendation for school schedules, and it is required for those who are entering school, primary public school or private school, as well as childcare facilities. So if you're wanting to put your baby into school around 6 weeks, or whenever, if they do start regular school around, kindergarten, they are gonna have to have those and those vaccines. So you might be thinking, what are some pros of getting a vaccine? So essentially, what are vaccines? They're basically something that you kind of get to help boost your body's immune system. And when babies are young, they don't have much of immune system, so they're very easy for them to get sick. So what that does is just basically kind of give them whatever injection that they need so they can build up a little bit of immunity until their body builds it, makes it on its own. So their infection risk is a little bit lower. And what are some cons? So, of course, pricking your baby, if you don't want to do that for your baby, that is a con, as well as there are some side effects. Side effects can mimic, basic flu conditions. So fever, lethargicness or tiredness, body aches, redness at where the baby did get that injection, and some swelling in that area for a little bit. And then, of course, if they're allergic reaction, each different vaccine does have different side effects to it. So definitely, if you are thinking about something, we can go over a specific one, or the doctor or where you get your shots from usually give you a handout and kind of talk about different ones and signs and symptoms to look for. Some resources are the World Health Organization, that is online, and I'll give you this paper, and it has everything that we talked about as well as the resources I'm about to give you. So that is really good for getting a kind of unified front what other countries are doing for their vaccination, as well as, since we live in Texas, the Texas website, the Department of State Health website, they go over vaccines, where you can get it, and is a little bit more closer to home since we are in the state of Texas. How does that sound?